Good day, RPO members and stakeholders. We thank you for the opportunity to give feedback on animal health and the work done for animal health throughout 2022. The National Animal Health Forum's core business is relationship building, constructive engagement, and the facilitation and coordination of activities for animal health between the public and private livestock sectors. I feel that this has been realized even stronger in the past few months. We can all agree that 2022 was not a very easy year for the industries regarding animal health. But despite this, we have achieved much more than we could have ever anticipated. Some of our objectives that I would like to light out, and to also just firstly and most importantly to again remind everyone that prevention is always better than cure. The National Animal Health Forum NPC is a forum that supports the implementation of the National Veterinary Strategy as defined by the Department of Agriculture, Land Reform and Rural Development. This is to ensure that all stakeholders involved understand the expectations and deliverables under the National Veterinary Strategy, to facilitate the cooperation between its members on a national and provincial basis, and to develop the common points of view with respect to animal health matters. The National Animal Health Forum has called together committees and projects to facilitate and effectively interact with the involved stakeholders, internal and external, on the deliverables of the National Veterinary Strategy. Here is some feedback on the progress of these committees and projects. What has happened since the previous message? In terms of foot and mouth disease outbreaks, the National Coordinator attended various joint operational committee meetings in the provinces affected by FMD outbreaks. A meeting was called by the DALOT Director General on the afternoon of 15th of August. At this meeting, the National Animal Health Forum members and stakeholders were informed of the nationwide ban on the movement of cattle. The Gazette notice was published on the 18th of August. On the 8th of September, a government gazette was again published for the control of the movement of cattle only in the controlled or disease management areas. The minister again lifted the control on the movement on the 7th of October by official gazette. The National Animal Health Forum, together with the RPO and other members, had radio and TV interviews for FMD awareness on most of the media platforms. We were inundated with inquiries, but managed to assist the stakeholders to get feedback and input from the national and provincial governments. Solution was to provide information on incentives to improve biosecurity, where good biosecurity will increase production costs. The National Animal Health Forum worked with the provinces and RPO officers to raise awareness at FMD workshops. The National Animal Health Forum also worked with the RPO to produce biosecurity signage for members to hang on their gates. We hope that this will also assist the members in raising awareness for biosecurity, and this will not only be for FMD, but all transmittable animal diseases. The National Animal Health Forum members have assigned an FMD team of experts to compile a strategy document, which was sent to the department for feedback. A meeting was also held with the department on 13 September. At the meeting, proposed plans from the industries were passed on to the department. A follow-up meeting took place on the 23rd of November, where the proposal was to work with the department on their strategy. When we look at what happened with vaccines in this past year, there were issues identified over the past few months, including the shortages of hard water blood and other blood vaccines. Strain 19. I was informed that some of the products did reach the Free State and KwaZulu-Natal areas, but not sure about the other provinces. Blue tongue, Ref1, African horse sickness, Pasteurella, Rift Valley fever inactivated vaccine, the 3-day stiff sickness, and then the bifemoral. The indication from OBP was that the products will be available in the next few weeks. A media release was received on the 1st of December. The reasons given for the unavailabilities are that there was a problem with the freeze drying machine, which had to be fixed by an international expert. The persistent power outages complicate production, whereby a possible solution was to consider alternative energy. The strikes of some of the personnel also caused trouble for the factory, but the matter has been addressed. As far as other facilities that are producing products, a facility in Pretoria has registered strain 19 and Rev 1. The facility will do a campaign on education, and a team has been dedicated to brucellosis. The approval from Act 36 and Act 35 is still ongoing for the approved carton to be used for a unique display. Forecasting is that there will be 1 million doses available in January to February 2023 for S19 and 100,000 doses for Rev 1. The shelf life of these vaccines is 24 months. This facility also have 3-day stiff sickness available. MSD also has the RB51 available with a 24-month shelf life. Regarding African horse sickness, various calls for feedback were directed to OBP for better feedback regarding the release of products. Meneer Gerard Skutte also arranged for a meeting with the NAMC to report the concern. The National Animal Health Forum made a presentation to raise their concerns. The SA Equine Health and Protocol will provide more on this matter after the EU audit was done in October. Through the Brucellosis Steering Committee meeting, it was brought to their attention that a laboratory operating east of Pretoria is testing for brucellosis with the Rose Bengal test without the necessary accreditation. As per Section 12 of the Animal Diseases Act, it is unlawful for a laboratory to test controlled or notifiable diseases without the necessary accreditation from SANAS, DALOD, and the Council, SAVC. The necessary evidence was gathered and included in a letter which was sent to the SAVC. Feedback from them was that the matter was considered by an investigating committee on the 1st of November, and they are finalizing the outcome of the meeting. Only once the outcome have been approved will they then start issuing the official outcomes of the matters. Another project that we are really excited about is the Veterinary Paraprofessionals project, which is driven by the EU FMD, the FAO, and the Health for Animals. The National Animal Health Forum forms part of the advisory committee for this project. A presentation was given at a meeting on the 22nd of November on the points raised by the National Animal Health Forum members to be mentioned at this committee. The National Animal Health Forum believes that this project will bring the needed capacity for animal health to the provinces. Another matter that has received a lot of attention is the need for authorization of private veterinarians to do state work. We need to seriously address this matter in 2023, and we look forward to your assistance in this regard. The National Animal Health Forum is hosting the Technology Innovation Agency Animal Health Cluster. The cluster members involve academic institutions, other governmental institutions, and animal health pharmaceutical members. An ideation workshop is scheduled for January. At this workshop, the goal will be to identify the priorities for research, technology, and development that will benefit the livestock sector in terms of improving animal health. The National Animal Health Forum also forms part of the University of Pretoria Onderstepoort Faculty Advisory Board. We will work hard with the faculty to ensure that the priorities identified at the TR ideation workshop is directed to them. The provincial animal health forums are doing well and have been extremely busy throughout 2022. At the recent National Animal Health Forum Members Council meeting, the proposal was tabled to work on a protocol for the structure of the provincial animal health forums. We will compile this document and share it with the provincial animal health forum members for input shortly. We are very excited to work together with the Red Meat Industry Services in 2023. We are grateful that animal health in the red meat industry has been placed at the top of the list of importance for the strategy. I would like to take this opportunity to thank the Red Meat Producers Organization members for their support of the National Animal Health Forum and myself as the National Coordinator in 2022, and for the massive amount of work that has gone into ensuring a healthy national herd. I look forward to working towards and producing an even stronger National Animal Health Forum with the red meat producers in 2023. Thank you.